Bismillahirrahmanirrahim. A 20-year-old woman is found to have a blood pressure 200 by 120. Uh, There's a left ventricular hypertrophy, but her examination otherwise normal. Urine analysis and microscopy are normal. She is on no medication. Initial blood test shows sodium, which is 136, potassium is 2.9, chloride, which is 100, urea 4.5, creatinine is 0.08. Plasma renin is mirrored and is found to be elevated. Which one of the following is the most likely diagnosis? She is a very young woman with higher blood pressure, with left ventricular hypertrophy. Remaining things are normal. Urine microscopy are normal, but potassium is low, which is 2.9, and elevated renin. What's most likely diagnosis? The case presented as of a young woman with severe hypertension associated with the hypokalemia. These features are suggestive of hyperaldosteronism, such as can occur with Cohn syndrome, primary hyperaldosteronism, or renal artery stenosis, which is secondary hyperaldosteronism. Renal artery stenosis of fibromuscular origin typically occurs in a young woman, so this option is correct, which is renal C, which is renal artery stenosis. This condition is an hereditary disorder which can affect the arterial tree of different sites, including renal, mesenteric, carotid, and even femoral arteries. The genetics have yet to be characterized. Typically in fibromuscular hyperplasia, an affected renal artery shows a beaded appearance on angiography. Stenosis causes increased renal level and a secondary hyperaldosteronism. So this is called secondary hyperaldosteronism because of renal artery stenosis. This you will see the renal angiogram in which is renal artery stenosis, so fibromuscular dysplasia. The Cohn syndrome is a condition due to adrenal adenoma, often small, producing excessive aldosterone secretion. It can be distinguished from renal artery stenosis by adrenal imaging and functional studies with a measurement of plasma renin and aldosterone. Plasma renin is suppressed in contrast to the findings in renal artery stenosis. Hypokalemia is not a typical feature of essential hypertension nor of pheochromocytoma, although it can be seen in a severe accelerated hypertension when the renal levels are raised. Diuretic abuse is often associated with the hypokalemia. However, the sodium chloride and urea levels most likely would also be abnormal. Diuretic abuse does not usually cause hypertension. So this is a renal adrenal pheochromocytoma, abnormal mass on the CT. These are the pictures they have given in these answers. So essential hypertension, diuretic abuse, renal artery stenosis, Cohn syndrome, pheochromocytoma. These were the options given. So this answer is correct answer is the renal artery stenosis. An 18-year-old woman has been brought to the emergency department for the assessment from the international airport, where she had felt unwell while waiting in the transit queue to check in for her return flight to an Asian country. She had been in the country for 3 weeks only, sightseeing and visiting relatives, and had an enjoyable holiday. She said that she was quite anxious about flying and was not looking forward to returning home. No other symptoms were elicited. During her appointment, she said that she has the strong feeling that she has been in the emergency department before, and that if everything and everyone there seems familiar to her. There's no record of her having been to the hospital before, and it would seem that she was only passing through the airport for the first time this morning. Which one of the following is the most likely explanation of deja vu experience. Options are depersonalization, Capgras syndrome in a patient with schizophrenia, temporal lobe epilepsy aura, a normal mental state phenomena, or head injury. So these are the options. Are deja vu experiences are false memories of past events. Familiarity is claimed in the present of for situations or conversations with the sense that this precise circumstance has occurred before. It is a disorder that involves memory, time, and recognition, and may be a normal mental state experience, especially during adolescence. So, option D is correct. Normal mental state experience. Anxiety and fatigue may contribute to this experience. Deja vu may be a part of the depersonalization syndrome, in which individual experience an unpleasant change in their sense of self and they feel unreal or apart. It's a disorder of subjective experience and perception, which is common with alcohol, cannabis use, anxiety disorder, depression, and possibly the use of antidepressant medication. This does not seem to be a part of this scenario. The Capgras syndrome is a rare delusional state of misidentification where an individual believes that a person well known to the individual has been replaced by an exact replica or doppelganger. It has been proposed as a specific malfunction in the face recognition area of the brain. It may be a part of the schizophrenic and bipolar spectrum disorder, but it's not the situation here. Temporal lobe epilepsy aura as an explanation is possible, but unlikely in this situation in the absence of other symptoms of autonomic visceral perceptual disturbance. Deja vu experience certainly occur with the direct stimulation of the temporal lobe, right more than the left, but other visual hallucinatory experiences would be expected, such as a disorder of perspective and size. Lesion in the medial temporal lobe classically give rise to a uncinate seizures, which include hallucinations of taste and smell, deja vu, and dreamy state, which has not been described here. It's not likely that head injury has been a factor in this scenario, because head injury was not mentioned anything regarding head injury. So this is a normal mental state of experience. Option D is correct, which is a normal mental state phenomena. Thank you very much.